Big question is how much Americans should worry that Ebola will spread now in the United States. Joining us to answer that question is Dr. Hernando Garzon. Dr. Garzon is the director for Kaiser Permanente's Global Health Program. He will be traveling to Sierra Leone this weekend as a volunteer with the International Medical Corps to help set up an Ebola treatment unit there. Dr. Garzon, we're going to talk about that in a minute, why you're going and how safe you feel, but so many of the questions that I just posed to Robert. When the takeaway from SARS was that the health privacy requirements of the individual are trumped by the communal health requirement to say that there's an infectious person in your midst. And everybody's takeaway, in addition to the health takeaways, was that. Why do we not know where this person came in from, what airlines they were on?
You know, I think we can actually do both. I think we can preserve patient confidentiality and privacy rights for the patient and still serve the public good in terms of doing the public health assessments we need to monitor who he came in contact with, get the manifest for the travel, family contacts, neighbors, incidental cab drivers, that kind of thing, without necessarily violating either the identity or the details of that. So I think we can serve the public need without having to violate the law.
The health officials have said, and we don't know whether to believe them, that if somebody gets a case of Ebola in the United States and is diagnosed, or at least suspected of it, it's not going to spread because we know how to contain in a way that they have not been able to do in West Africa. Is that true?
I agree with that. As a physician and a scientist, I believe in the process. I think the infrastructure, both societal and public health infrastructure in West Africa, is very different than we have here in the United States. And in the United States, we are already on alert and on tiptoes around this.
Is it reasonable that a person who goes to a doctor complaining of a flu should be suspected of having Ebola in the United States at this point? I
think there are so relatively few travelers returning from that area. Yeah. I don't think that you need to interview every single individual. Someone in high-risk areas, big travel zones like big cities, Los Angeles, New York, that kind of thing. Yes, it's something to be mindful of. If you know somebody has an ethnicity that may be coming back or has worked there, you can ask about that. But not everyone with a flu or a sniffle is likely to have it.
You obviously have gone, you work in infectious diseases, you understand this, you know, you don't come with that built-in panic that people sometimes do, but people are going to ask, are we now in danger? The other two health workers came here in isolation, were put into Emory in isolation, entirely controlled circumstances, were treated, and nobody else got Ebola. This is a different story. Someone was walking around with Ebola.
That's true. So I'm an emergency medicine specialist, and I have a lot of experience in disaster response. So I'm not an infectious disease specialist, but I can address this because I've been doing a lot of.
What I mean is you've worked in regions. You've gone to places where there have been these issues.
Right. Absolutely no need to panic in the United States at this point. I mean, we have a containment procedure in place, and it's already been activated. The moment this person was identified, he was already quarantined, isolated, and tested. Test came back very quickly, and already I'm sure they have done the process to identify all the potential contacts. So that I think the likelihood of spread in anything similar to what's happened not only in this outbreak but in any other outbreak in the past, for that likelihood in the U.S., no, it's not going to happen.
Now, you're on your way to Sierra Leone. This is interesting. Did I hear that you were taking your kids there too?
No. My children have accompanied me in some past disaster responses.
But what do you have heightened concern? I imagine you've read in and you're very aware of all the protocols?
Of course. I think anybody going to work in these disaster areas, or particularly in Ebola, has to have some amount of concern about this. Certainly every time that a healthcare worker is reported to be infected or suspected of being infected, it's a concern for all of us. I think it's a matter of risk assessment and evaluating why are healthcare workers getting infected, what's the mechanism there, and how can we prevent that for future workers in this area.
So are you going to do things differently than you might have even 6 months ago?
Well, you know, I think many of the people that have been infected, healthcare workers so far, were either working before they knew they were dealing with Ebola or working in situations where they didn't have appropriate protective equipment or didn't have adequate training. I think it's very different now for relief workers who are there now as opposed to relief workers who were there 2 or 3 or 6 months ago. So absolutely.
Dr. Garzon, we wish you the best, and we admire you for taking these risks and doing good for the world. Thank you.
Thank you very much.
Dr. Hernando Garzon is the director of the Global Health Program at Kaiser Permanente.